Hello everyone, this is Dr. Sultan Muinuddin Shaukat. Welcome you to IkraMed Academy. Today we are going to start an interesting topic which is the ultrasound features of thyroid parenchymal disease. इससे पहले हमने देखा है the technique of ultrasound, that is the ultrasound technique for thyroid gland. Then we saw about various benign lesions. We saw what is thyroids, how do we give thyroids. We saw features of various thyroid malignancies, that is follicular, anaplastic, papillary, medullary neoplasms, and then we saw about thyroid gland lymphoma. So there we finished off all the neoplastic type of etiologies, benign as well as malignant. अब इस लेक्चर में we are going to see a special type of thyroid diseases, especially what we call them as thyroid parenchymal disease. What do you mean by thyroid parenchymal disease? These are those diseases in which the thyroid parenchyma is involved. Okay, here the entire thyroid parenchyma is involved rather than a focal lesion inside the thyroid gland. And let me tell you that this is one of the spectrum of disease जो आपके clinical practice में बहुत ज़्यादा आएंगे, बहुत ज़्यादा. So some to enumerate out of this are Hashimoto'S thyroiditis, which is autoimmune thyroiditis. Second, you have Graves' disease. It's a very important diseases, both are autoimmune. Then we have D. Quervain's synovitis. Okay, so we'll be starting with all of one by one. So without any delay, let us begin the topic. So first, let us start with very fundamentals. So I'll be starting with Hashimoto's thyroiditis. Okay. So we'll be starting with a special disease which is called Hashimoto's thyroiditis. Okay. जो basics आपको आना चाहिए, okay, to start with this is that you should know that बहुत ही fundamentals, okay. Most of you must be knowing, बहुत सारे लोगों को आता रहेगा, but फिर भी as a part of revision and जिन्हें नहीं आता है उन्हें समझ में आ जाएगा, is that thyroid is an endocrine gland. So this is the thyroid gland, correct? Thyroid is an endocrine gland. Now thyroid secretes T3, T4. Remember T3 and T4, that is thyroxine hormone T4. Now very important, TSH is not the hormone of thyroid gland. So who secretes TSH? There is a special gland which is called pituitary. Pituitary secretes TSH. So TSH stimulates thyroid gland to release T3 and T4. एक बार जब T3, T4 रिलीज होते हैं तो ये रिलीज होने के बाद एक नेगेटिव फीडबैक भेजते हैं पिट्यूटरी को कि हम रिलीज हो गए हैं, आप TSH के अमाउंट को कम करो. यानी once T3 and T4 are released, they give a negative feedback to pituitary that you decrease the amount of TSH. Okay, this is how a feedback works in our body. Now what happens in case of Hashimoto's disease? In case of Hashimoto's disease, this is an autoimmune disease. Autoimmune. So what do you mean by autoimmune? It means that हमारी बॉडी की इम्यूनिटी हमारी बॉडी के खुद के टिश्यूज को डैमेज करेंगे. Okay, that is called autoimmune disease. So there are special antibodies which are synthesized. Okay, some amongst them to name are anti-TSH antibodies and anti-thyroglobulin antibody, anti-TPO antibodies, that is thyroid peroxidase antibody, anti-thyroglobulin antibody. अब ये एंटीबॉडीज जब रिलीज होते हैं, दे गो इन थायराइड ग्लैंड. And what do they do? These antibodies, they destroy the thyroid gland. एंड डिस्ट्रक्शन कैसे होता है, आधा एरिया एट अ टाइम, देन बाकी का. सो देर आर सम normal areas which are remaining. So initially those areas would be functioning well, but later on when the entire thyroid gland is damaged, it would there will be so initially there will be increased inflammation, increased vascularity in the gland, but later on जब सब कुछ डैमेज हो जाएगा, okay, तब the entire gland will be replaced by all fibrous tissue, okay, and this would just look like muscle. This would just look like a muscle. And so what will happen, this gland will not do the function of the thyroid gland. As a result, you will have that T3 will not be there, so T3 will go down. T4 will not be there, so T4 will also go down. So you know that T3 T4 were giving negative feedback to the pituitary, right? So now there is no negative feedback, so this will lead to increased TSH synthesis by the pituitary gland. Okay, so this is how on biochemistry you will be able to diagnose uh, that this is hypothyroidism, and you will be able to detect these two antibodies inside the blood. So anti-TPO antibody, anti-thyroglobulin antibodies are very important when it comes to Hashimoto's thyroiditis. Okay, now with all this basic pathogenesis, let us come to how and what the epidemiology and rest of the things are. So when it comes to Hashimoto's disease, this is an autoimmune disease, very important, and there is lymphocytic infiltration. So this is called lymphocytic thyroiditis, and there are autoantibodies against thyroglobulin that we have seen, anti-thyroglobulin and anti-TPO antibodies. Then the entire gland becomes enlarged because of lymphocytic infiltration, heterogeneous hypoechoic cores, and initially the vascularity increases in acute phase because of inflammation. Okay, vascularity बढ़ जाती है, but later on there is hypothyroid because lymphocytic will be replaced by hypothyroidism due to lymphocytic replacement of the normal thyroid parenchyma, and you will see that uh, associated with autoimmune conditions. So it can be associated with Sjogren's syndrome, it can be associated with other autoimmune like sarcoidosis. So in the end, you might find that the gland becomes atrophic. Okay? The entire gland becomes atrophic and just like the muscle. Okay. So if you want to remember the key points, autoimmune disease, autoantibodies against thyroglobulin, lymphocytes infiltrate the gland, and initially in acute phase there is increased inflammation, but as there is chronic phase, the entire glands become small, atrophic, and muscle-like. Okay, this is what you have to remember about Hashimoto. Now let us come to the ultrasound images for easy understanding. Chalo. Now let us see this first thing. So here in A, you are able to see this is the thyroid gland. And you are able to see that this thyroid gland is heterogeneous. Can you see that there are multiple small areas? That indicates that the inflammation is going on within the thyroid gland. This should not be confused with thyroid nodules. Okay, this is active inflammation. And if you, along with that, you can see that there is a lymph node enlargement. So very important, lymph node enlargement is also a very important feature of Hashimoto's thyroiditis. Okay, if you put vascularity, then you see that in acute phase there is increased vascularity in thyroid gland. Okay, this is how the vascularity of the thyroid gland would be appearing, that is there will be increased vascularity. Okay, now let us see the case B. So here are you able to see the thyroid gland which is enlarged, but how is it looking? This is looking just like a muscle. This is just looking like a muscle. So fibrous tissue have entirely replaced the thyroid gland. So this is muscle-like appearance of thyroid, which is classically seen in case of Hashimoto's thyroiditis. Now, I've told you in just few minutes back that Hashimoto doesn't affect, so it starts affecting few areas. So initially you'll have a few areas which are normal and few areas which are affected. The affected areas would look hypoechoic and the normal areas would look hyperechoic. So that's a beautiful example which you can see here in image C. So here you can see that this thyroid gland, and within the thyroid gland you are able to see this islands of normal areas. So these are residual normal areas, and the affected area is hypoechoic. This is the affected area. Affected area is hypoechoic, and this is the normal area which remains hyperechoic. So this type of pattern again you can see here in this image. This is the thyroid gland, and you can see that there are multiple islands of normal areas within the thyroid gland. Correct? So this should not be mistaken for thyroid lesions or thyroid nodules or MNG, multinodular goiter. This type of pattern is called giraffe pattern. Giraffe pattern. So you have seen a giraffe, where giraffe has got lots of if you see giraffe on its back, it has got lots of uh, normal appearing spots. So these spots inside the thyroid gland represents looks like that of giraffe, and hence this is called giraffe pattern. Again, this is a beautiful example of thyroid gland, and you can see those normal areas within the abnormally hypoechoic gland. So this is again the giraffe pattern, which is very classically seen in case of Hashimoto's disease. Okay. So this was about Hashimoto. So to summarize, Hashimoto autoimmune disease, three important features on imaging. Number one is you see that the gland is heterogeneous, bulky, ecotexture is altered, vascularity in acute phase increases. In chronic phase, it becomes muzzle-like, and you find that there are sometimes you find that there are interspersed normal areas in between the affected gland. They looks like giraffe spots. Okay. Now we come to the next important pathology of the session, which is Graves' disease. This is Graves' disease. Okay. Now I will start with very fundamentals again. You know that there is a thyroid gland in the neck. This is the endocrine gland which releases T3 and T4. Barabar? This is under the control of a special gland which is pituitary gland. You are aware of that now. Pituitary gland controls thyroid with TSH. TSH stimulates thyroid to release T3 T4. यानी कि TSH रिलीज होगा तो T3 T4 बढ़ेंगे. T3 T4 बढ़ेंगे तो वो पिट्यूटरी को नेगेटिव फीडबैक देंगे कि TSH कम करना है. दिस इज हाउ द नॉर्मल वर्किंग गोज ऑन. सपोज TSH नहीं है तो T3 T4 भी क्या हो जाएगा, कम हो जाएगा. ओके. नाउ ग्रेव्स डिजीज की पैथोजेनेसिस इज समवट similar but paradoxical to that of Hashimoto. So in Graves' disease, again this is autoimmune disease. This is autoimmune disease. Okay. Graves' disease is also autoimmune. Now